Some background information. The resident Benny is 74 years old. He has a diagnosis of gastroesophageal reflux disease, type 2 diabetes, hyperlipidemia, hypertension, and cerebral palsy. At first look from the doorway, he is alert, he can hear me, he is breathing, there's no evidence of blood loss or a lack of perfusion. And hi there, Benny. My name's Jenna. I'm your nurse today. Closing the door behind me. And hand sanitizing. Benny, can you tell me your full name and date of birth?
Sure, my name is Benny Brown, birthday September 5th, 1951.
Great. And if I look at your armband. Great. And looking in the electronic health records, his name matches, as well as his armband. All right, Benny, we're going to be doing a head-to-toe assessment today. Does that sound all right?
Sure.
Okay, great. So we're going to start with some vitals. So his pulse ox is 93% on room air. His heart rate is 70 beats per minute. His respirations are 20 breaths per minute. His blood pressure is 135/65. His temperature is 97 degrees Fahrenheit. And I'm also assessing for orthostatic hypotension due to the medications he's on. So his standing blood pressure is 110/65. Benny, are you experiencing any pain today?
Yes.
I'm sorry about that. If you were to rate it on a scale of 1 to 10, with 10 being the worst pain, how would you rate it?
Probably around a 4 out of 10.
Okay. And can you tell me a little bit more about this pain? Where is it located? And what does it feel like?
It is a burning sensation in my chest.
Okay. And when did this pain start?
Just after lunch.
Okay, that makes sense. We're going to go ahead and go into your neuro assessment. Can you tell me where we are?
Yes, I'm in a long-term care facility.
Great. And can you tell me why we're here?
Due to my cerebral palsy.
Great. And can you tell me what time it is or the date?
It is April 13th, 2025.
Great. Have you been experiencing any headache?
No.
How about any nausea or dizziness?
No to both.
Okay, great. I'm going to go ahead and look at your pupils real quick, so you can just look straight ahead. I'm going to shine a little light in your eyes. Right. And can you smile for me? Great. And open your mouth. Okay, great. So, so far I can tell the resident is ANO by 4. He is aware of his self, place, situation, time, setting. His pupils are equal, round, reactive to light, and accommodating. His smile and face are symmetrical. His mucous membranes are a little bit dry, but still intact. His speech is coherent and clear. And his affect so far has been positive and appropriate for the situation. All right, Benny, we're going to move into your respiratory and cardiovascular assessment next. Normally this would be done on bare skin. All right, have you been experiencing any difficulty breathing?
No.
Okay, great. I'm looking and assessing his chest. He has a little bit of decreased chest expansion and some increased difficulty breathing, so a little bit of some labored breathing. Let's see. Great. I'm going to go and reporting no dyspnea. I'm going to go ahead and listen to your lungs, okay? Okay. All right. So first we are listening to the anterior upper lobe of the lungs, anterior left upper. Go ahead, take a deep breath for it. And the right upper. The anterior left lower. anterior right lower. Okay. And we're going to the back. We are listening to the posterior left upper lung, posterior right upper lung, posterior left middle area of the lung, posterior right middle area of the lung, posterior lower left area of the lung, posterior right lower area of the lung, the lateral posterior or lateral left area of the lung, and the lateral right area of the lung. So I am hearing some bilateral wheezing in the upper lungs. To further address this, I've also listened to the timing of the wheezing, which is intermittent and not continuous. The left lower lungs are both clear, equal bilaterally, with no diminished lung sounds and no abnormal lung sounds like wheezing or rhonchi or any crackles. And Benny is not on any O2 administration. Have you been experiencing any coughing?
I have an occasional cough.
Okay. And how about any difficulty swallowing?
No issue swallowing.
Okay, great. Moving on to the cardiovascular section, I am assessing his chest. His chest is symmetrical. There is no edema. There is no ecchymosis or erythema, so no discoloration. I'm going to go ahead and listen to his heart at Erb's point. And his heart has a regular rhythm, so you don't need to listen to the apical pulse. I can clearly hear the S1 and S2 sounds. There are no S3 and S4 sounds, brutes, or murmurs. And have you been experiencing any other chest pain other than what we already talked about?
No, just what we talked about.
Okay, great. We're going to go ahead and move on to his abdomen, which again would be done on bare skin. Go ahead and lay down for me, Benny. So first I am looking, the abdomen is symmetrical, there's no distension, there's no erythema or ecchymosis, and no ascites. Then I'm going to go ahead and auscultate. I'm expecting to hear hypoactive vowel sounds about every 20 seconds, and I'm going to be starting in the right lower quadrant. Moving to the right upper quadrant. Moving to the left upper quadrant. And the left lower quadrant. And then going to palpate, starting in the right lower quadrant. Benny, if you feel any pain while I'm pressing on your abdomen, let me know. Moving to the right upper quadrant. Moving to the left upper quadrant. And the left lower quadrant. There's some rigidity in the left lower quadrant. Do you feel any pain, Benny?
No.
All right, and no pain. A few questions for you. When was your last bowel movement?
Probably about 2 days ago.
Okay. And can you describe it for me? What was its color? Did it have any mucus in your stool?
It was kind of a pale brown, and yes, I think there was some mucus.
Okay. And do you have any difficulty stooling?
Yes, a little.
Okay. And when you urinate, do you feel like you're completely able to empty your bladder?
Yes.
Good. Do you have any difficulty making it to the bathroom?
Only when there's no one to assist me out of my wheelchair.
Okay. And do you have any pain with urination?
No.
And when was the last time you urinated?
Maybe about 3 or 4 hours ago.
Okay. And what color was it? What did it look like?
It was a darker yellow.
Okay, great. I'm gonna go ahead and feel your kidneys. Will you let me know if you feel any pain? Do you feel any pain?
No pain.
Okay. And the right kidney, do you feel any pain?
No pain.
Okay, great. And then I have been doing a skin assessment throughout here. So the skin has been pink, it has been warm, some dryness on the back, but no moisture. He has some decreased turgor with some tenting. I would assess the genital skin if there's any complaints of pain with urination, any odor or discharge complained of, or excess moisture, but none of that is there. And then I'm going to go ahead and look at his arms here. So his arms are pink. They are warm. The skin is intact. The skin is intact throughout the rest of the body so far as well. I'm going to feel his radial pulse. Just your arm if you want. And I am feeling this for 30 seconds, expecting his pulse to be regular, equal bilaterally, with a +1 strength. I am then going to be feeling his fingertips here. Checking his capillary refill, which is expected to be 5 seconds. Benny, can you feel me squeezing your fingers?
Yes.
Okay, great. Your other hand. And can you go ahead and push against my hands? Great. And just same way, can you pull? Great. And can you squeeze my fingers? Great. And can you, to the best of your ability, lift your arms in front of you? Great. And how about to the side? Okay, great. So Benny does have some decreased strength and range of motion in his upper bilateral extremities due to his cerebral palsy, but he has great strength in his hands and still has sensation. Moving on to his legs. His legs are pink, the skin is intact. Again, some dryness, but no excessive moisture, and they are warm. Moving down to his ankles, he does have some edema in his ankles, and it is a little bit of erythema and a warmer temperature. Probably +2 edema with no pitting. I am then feeling his posterior tibial pulse, feeling for 30 seconds. I am expecting the pulse to feel regular and equal bilaterally with a +1 strength. And next, moving to his dorsalis pedis pulse. Again, feeling for 30 seconds because I am expecting his pulse to be equal bilaterally, regular, and a +1 strength. And then moving on to his capillary refill on his toes. Expecting it to be 5 seconds. Benny, can you feel me touching your toes?
Yes.
Okay, great. All right, and can you press down on my hands like a gas pedal? Great. And how about lift up against them? Okay, and to the best of your ability, can you lift your legs? Okay. Great. So again, Benny has decreased range of motion and strength bilaterally in both of his legs, but he still has sensation in his feet and toes. Have you been experiencing any like muscle cramps?
Yes, in my legs and my arm.
Okay. Additionally, I am using the Braden scale to assess for any risk of pressure wounds due to his immobility. He is 13, so he is at risk for pressure wounds. And then, Benny, we're going to take your daily weight just to keep a track of the swelling, the edema that's going on in your ankles. So your weight is 172 pounds today. Did you have any coffee with your breakfast this morning?
Yes, I did, and the chest pain started after that.
Okay. Were you still able to make it to your Bible study?
Yes, I was, and I was able to lead a great discussion.
Okay, great. That's good to hear. So I think that wraps up our assessment. Thank you so much.